night. The island received a shipment of 50,000 doses of the AstraZeneca vaccine this afternoon as a gift from the people and government of India to begin the country's vaccination program.
This is a start. There is a schedule of delivery. We will start on Wednesday. It's healthcare workers who will get priority, and then we move from there to vulnerable communities, 60s and over, with comorbidities in the first instance.
The Ministry of Health and Wellness has reported that of the 878 COVID positive cases recorded yesterday, 500 were females. Dr. Christopher Tufton takes to social media to warn Jamaicans that the high rapid increase in COVID-19 cases will result in the health system experiencing significant stress and fatigue.
Let it sink in that that positivity rate means that our hospitals are going to come under pressure, significant pressure. Let it sink in that our public health workers, our nurses, our doctors are going to find it very difficult to cope with those who come in and need medical care.
And Jamaican women lauded for their extraordinary work in leadership during the delegation of the European Union to Jamaica and the United Nations panel discussion this morning in celebration of International Women's Day.
We say women who are or have been leading in their respective fields. They have or are showing the way, like you, Jamaican women leaders participating in this event today. You are excelling, probably more than man, not because you're women and not because women are better than man.
A gift from the people and government of India to begin the country's vaccination program. Minister of Health and Wellness Dr. Christopher Tufton, who was on hand with Prime Minister Andrew Holness and other officials, welcomed the shipment into the country at the Norman Manley International Airport. Dr. Tufton, in speaking with the media, said that the schedule of delivery of the vaccine will start on Wednesday.
See the beginning of the end in terms of the type of threat that the pandemic represents. So this is a start. There is a schedule of delivery. We will start on Wednesday. It's healthcare workers who will get priority, and then we move from there to vulnerable communities, 60s and over, with comorbidities in the first instance. And then the rest of the population, the police, the JDF, the other uniform workers. So we are ready in the field. The team is out there. We have done a few trial runs, and so you'll see and hear more about the delivery as of Wednesday of this week.
Dr. Tufton further pointed out that the second shipment of COVID-19 vaccine is on schedule to reach the country on March 11.
As far as we know, it's on schedule as 14,400, and as part of the COVAX facility. So we anticipate having that, which will give us at least 64,000 in the month of March, with a priority group to be targeted. It will also allow us to move through a learning curve and therefore develop and enhance the process so that when larger amounts come in, we can deliver more efficiently. So we are fairly comfortable with those numbers, at least for the rest for this month of March.
The Ministry of Health and Wellness has reported that of the 878 COVID positive cases recorded yesterday, 500 were females. To date, 15,044 females and 11,857 males have tested positive for the virus. A total of 26,904 confirmed infections, with 454 deaths after a 63-year-old man died yesterday. The parish with the highest number of cases for the day was St. Catherine, which had 187 cases, while St. Mary and Hanover had the least number of cases with 17 and 16 respectively. Kingston and St. Andrew had the second highest number of cases with 179 new infections, followed by St. Anne with 88 and St. James 86. The other cases are as follows: Clarendon 68, Manchester 58, St. Thomas 56, St. Elizabeth 49, Portland and Trelawney 25 each, and Westmoreland 24. The age range for the new cases is 8 months old to 98 years old. Active cases stand at 11,770 after 146 recoveries for the 24-hour period, with a total of 14,447 persons who have recovered from the virus to date. The Ministry of Health and Wellness announced of a 24-hour record of 723 positive cases from 2,640 tests at a positivity rate of almost 36%, along with 7 people who have died from complications related to the virus in the previous 24 hours. This pushed Minister of Health and Wellness Dr. Christopher Tufton to take to social media to warn Jamaicans that this will result in the health system experiencing significant stress and fatigue.
We had a 35.9% positivity rate with some 723 Jamaicans testing positive for the coronavirus. Let that sink in. Let it sink in that that positivity rate means that our hospitals are going to come under pressure, significant pressure. Let it sink in that our public health workers, our nurses, our doctors are going to find it very difficult to cope with those who come in and need medical care. Let it sink in that it means longer waits. It means persons having to suffer for longer periods before they can get a bed. And generally speaking, a health system that is going to experience significant stress and fatigue.
Dr. Tufton further pointed out that persons are not trying hard enough to follow the protocols.
Ladies and gentlemen, Jamaicans, the truth is we're not trying hard enough. I accept that the government has a responsibility. But let us be clear, a lot of the spread that is taking place in this country is because too many of us are ignoring the need for personal responsibilities. It must sink in to all of us that the government alone, the public health system alone, our nurses, our doctors alone, the cabinet of Jamaica alone cannot address this virus and its spread and the consequences that it will have on our people. It must sink in that 723 persons in one day, and more importantly, over 3 out of every 10 persons tested are positive, means that corona is right across the length of our population. It must sink in that if you continue to have the parties, the drink-ups, if you continue to ignore the protocols around gatherings, and you congregate and you don't wear the mask, then the chances of your getting the coronavirus are real.
The health minister further expressed that more people are going to contract the virus or die if more effort is not made to follow the protocols in place to reduce the spread of the virus.
I believe that it is very important that all of us appreciate and understand the consequences of our action. This is not an attempt to rid government of its responsibilities, contrary to what some may say or some may think. The truth is, we do not have enough policemen or soldiers to police every shop in Jamaica, to police every beach in Jamaica, to look over every single individual in this country. And it is downright unfair for persons to blame our public health officials, our public health team, our doctors and our nurses when they cannot get through at the hospital because they are there because they went to the party that they should not have gone to, or to the beach or the funeral that they shouldn't have congregated at, and have picked up the virus, and then they expect the government or the public health system to solve the problem. And if we don't do it, we get costs. So yes, I am saying 723, March 6, a 35.9% positivity rate. I really hope that will sink in. And it will sink in in our consciousness to help us to understand the importance of personal responsibilities.
The new field hospital, which opened in Falmouth, Trelawney yesterday, is already expected to be at full capacity today as Jamaica continues to report a record number of COVID-19 cases. Meanwhile, Health and Wellness Minister Dr. Christopher Tufton has disclosed that 7 patients were scheduled to be admitted to the newly constructed $36 million COVID-19 field hospital in Falmouth General Public Hospital yesterday. He noted that medical personnel have already been recruited to man the hospital.
We now have 36 additional beds to add to this western region. Already, the hospitals here are at capacity, with Cornwall Regional over 130% for COVID bed occupation. So I'm told that by this weekend, Sunday, we should see patients being placed in this ward. There are at least 6 or 7 that are ready to be put into the ward. We have also started the process of hiring, and have already hired, I am told, some doctors, nurses. Some rearranging has to be done also. The hiring continues, but permission has been given, and I know the recruitment has started, and so far we're making progress. So we have the building, we have the equipment, thanks to support from PAHO, all new equipment, nothing here used. And we have the personnel. And when you combine all of those together, what you have therefore is a ward that's ready to be utilized. I want to take the opportunity to thank the team, starting with the Regional Health Authority, the senior medical officer here, the chief nurse, the parish manager, and all the others who have done what is necessary to ensure that we have delivered this facility in record time, I'm told. And the contractors have done a good job, as you can see. It's a really nice facility. It's a significant addition.
Noting that COVID wards in the Western Regional Health Authority are filling up, Dr. Tufton welcomed the increased capacity and said that this addition is a plus for the Falmouth Hospital.
One interesting thing about Falmouth, which I know is worth noting, is that 5 years ago, Falmouth was under 100 beds. Today, as a result of COVID and also the challenges at Cornwall, Falmouth now can boast over 220 beds. So assuming we get past COVID, what you have here at Falmouth is a much larger facility by bed count, by personnel, by services offered, and it really augurs well for this hospital, this institution, and indeed it's worth looking at how we increase the specialist services and upgrade the facility. And it's timely because of the development that is taking place in the parish. So I think Falmouth is a winner in a strange way because of the misfortune and the challenges that we have had in the country from COVID, but also at Cornwall Regional Hospital. It shows the responsiveness of the team, and they have been able to deliver. And I'm happy to say the people of Trelawney and its environs will be better off for it. So it's something that we're going to need to look into and see what else can be done to upgrade the facility and provide some additional care.
For his part, Regional Director of the Western Regional Health Authority, Errol Green, says that patients from the Cornwall Regional Hospital will be transferred to the newly built facility as a means to ease the pressure of that hospital.
We still have a problem with finding space to put beds. This is a senior medical officer for this institution, the Falmouth General Hospital. He will tell you that we have to observe infection control standards and so on. And therefore we have to be mindful of how we place the beds. This facility that's being opened today, the facility at Falmouth Hospital, is expected to take the pressure of Cornwall, Sav, and Noel Holmes. Already, we have about 30 patients at Cornwall, which is expected to be transferred here by early next week in order to free up some space there. We have some concerns, however, because as you can see, the place is well suited. Every equipment in here is new, brand new beds. We have not just ordinary hospital beds, but beds that are suited for intensive care units and high dependency units and so on. And our concern at the outset, while we don't want to be pessimistic, is that we would hate to know that we build this facility and it is packed up with the social cases, because we have to try to do what we can within our best efforts to ensure that those who are most needy of the services can be accommodated here.
And a senior medical officer at the Falmouth Public General Hospital, Dr. Leighton Perrins, pointed out that as the hospital treats patients with COVID-19 symptoms, they are also careful to ensure they too look out for patients with respiratory-like illnesses.
There is a spike in suspected as well as positive COVID patients. We're seeing more patients with influenza-like illnesses, and so we have to rule everyone out to ensure that we don't mix normal patients with patients who may have COVID. Although we're sensitized to with COVID-19, with the pandemic, we still have to look at other patients with respiratory symptoms. I mean, you have asthmatics, you have people with Guillain-Barré pneumonia. So these are things that when we see these type of patients, we still will swab them if they're going to be admitted to the institution, because all patients who get admitted to the institution, gets nasopharyngeal swabs. But then we have to ensure the swab results don't come back within a couple of days. So, that's where the challenge is. I can't say for Trelawney, I can only speak for Falmouth Hospital. Well, currently, from the census, we only have 4 patients that are positive. But we have quite a few that are suspected that we're ruling out.
In other news, Mayor of Montego Bay and Chairman of the St. James Municipal Corporation, Councillor Leroy Williams, has announced new arrangements by the council to facilitate meetings via Zoom and adjusted working schedule due to the spike in COVID-19 cases in the parish.
The municipal corporation has decided to have in the council persons on a week-on, week-off basis because of the spread of COVID. We want to ensure that at least social distance is practiced in all the departments that we have at the municipal corporation. And I must also say that we have decided to have our meetings virtual. So our council meetings and our various committee meetings will be virtual, at least for the next 3 or 4 weeks. So, of course, we will abide by what the Prime Minister is saying, and based on the decision made there, then we can do the necessary adjustment. But definitely, we are on a week-on, week-off operation.
Mayor Williams also pointed out that even though no one at the council has been laid off, the council's revenue stream has been extremely slow due to the COVID-19 pandemic.
COVID has had a deleterious effect on our operation at the council. For example, our revenue stream has been very slow, and this is because a number of persons cannot afford to pay the different types of fees that are to be paid to the council, such as trade license, you have building fees, barbers and hairdressers fees, you have building, well, I mentioned building fees before, but quite a number of the fees, persons are not able to pay them. So as a result of that, it has seriously affected our revenue. However, I must say, notwithstanding that we were able to maintain our staff, no one has been laid off. We had to do some adjustment in terms of overtime, but everybody is still on the job.
Pointing out that he will be first in line to take the vaccine when it becomes available to him, he said that because of the irresponsibility of persons rather, while the virus continues to spread.
We are hoping that with the expectation that the vaccines will be in the island soon, that we should be seeing a few less persons having COVID. But I do not think it will make a difference in terms of what we are earning as a council, especially from our own source revenue. I will be the first in line when it comes to our term as politicians. Certainly, I'll be the first in line. The public will be encouraged to take the vaccination. There's that spike in the parish of St. James. But as I've often said before, that persons need to take responsibility. And it's because of the responsible nature of persons why it is spreading. The protocol has not been observed by many persons. Persons out there feel, well, COVID, I can't catch COVID. And that is not so. So it's just carelessness on the part of many persons why we are having this spike.
The Freeport Police in St. James have commenced an investigation surrounding the death of 5 persons, including a dancehall entertainer and a teenage student who were shot and killed in the parish on the weekend. Those killed have been identified as 26-year-old Adrian Alexander, otherwise called Father God, a recording artist of Cassava Walk in Albion, 16-year-old Omarion Campbell, a student of Peace View, also in Albion, 33-year-old Daryl Richards, a data entry clerk of Tank Lane in Salt Spring, 41-year-old Brian Coote, otherwise called Tad, a farmer of Kensington District, and 35-year-old Jermaine Brown, otherwise called Jail Bud, a painter of Fairfield, Irwin, all in the parish of St. James. The police reported that Alexander was gunned down on Friday morning while he was attending a recording studio in Albion, while Campbell was shot and killed during a reprisal attack in Peaceview, Albion on Saturday afternoon. Brown was shot and killed in Hopetoun District on Saturday night after he went to visit a female in the community and was shot by her baby father. Richards was gunned down in Salt Spring community by unknown assailants, while Coote was also shot and killed in his community by armed men on Saturday. Meanwhile, reports are that about 5:05 p.m., the 2 students, 16-year-old Omarion Campbell and a 13-year-old, were purchasing items at a shop in Peaceview when a grey motor car drove up from which men brandishing guns alighted. The men opened fire, hitting the 2 teenagers. The police were called and the 2 students were taken to hospital, where Campbell was pronounced dead and the other teen was admitted in serious but stable condition. No clear motive has so far been established for the shooting. The police have reported that since the start of the year, a total of 38 persons have been murdered in the parish of St. James. Meanwhile, Mayor Leroy Williams has said that a meeting is being organized with the security forces and stakeholders in the parish to address the increase in crime and murders.
I am concerned over that crime situation. As a matter of fact, I'm in touch with the superintendent of police, Superintendent Vernon Ellis, and we plan to invite our stakeholders and the agencies to a meeting to discuss the whole matter of crime. And I'm sure from that we should see some result in terms of a drop in the crime rate.
A joint police-military operation has resulted in the seizure of a firearm, 4 rounds of ammunition, and the arrest of 3 persons at a hotel in St. James on Sunday. Reports from the Montego Bay Police are that between the hours of 11 a.m. and 2 p.m. yesterday, the The premises of a hotel on Queens Drive in the parish was searched, and a 9mm pistol with the ammunition was found in a room. The occupants of the room were subsequently taken into custody. The identities of the suspects are being withheld as lawmen commence investigations into the incident. The St. Catherine police say they have arrested a 16-year-old boy in connection with the murder of 43-year-old Rowan Martin, otherwise called Roger, a promoter of Portmore address in St. Catherine, who was gunned down while attending a funeral service being held for a relative in Portmore. Reports from the Portmore police are that at about 2:30 p.m., Martin was attending the funeral service being held at Macpherson Drive in Old Brayton, Portmore, when a Nissan Latia motor car with 3 men on board drove up. One of the men, who was later identified as the teenaged boy, alighted from the vehicle and opened fire, hitting Martin multiple times. The men then sped away in the waiting motor car, but a police team that was on location to enforce aspects of the Disaster Risk Management Act saw what unfolded and pursued the gunmen. The lawmen intercepted the motor car in the Greater Portmore area, but as soon as the car came to a stop, two of the men managed to escape, but the teen was held and a Springfield 9mm pistol and a magazine containing 1 round was taken from him. The police are still in search of the 2 other gunmen who managed to escape. Detectives are now investigating an incident this morning along the Michael Manley Boulevard in the vicinity of Manley Meadows, where an unidentified man was seen with gunshot wounds to the upper body. It is reported that passers-by discovered the body on the road and alerted the police. It's not clear whether the body was dumped there. The East Kingston police are investigating, and we will bring you more details on this story in subsequent newscast. 31 persons are now homeless, with 1 woman suspected to have been burned to death following a fire on Beeston Street in the vicinity early this morning. Dead is 37-year-old Latoya White, also known as Stacy, a mother of 3 children and a vendor at North Parade who celebrated her 37th birthday last Saturday. One friend of the deceased said it is alleged that Miss White's throat was slashed by her boyfriend, who then allegedly set the house on fire.
Sis is a very jovial person, loving, caring. I never expect this for her, for she lose her life, chat it like this. Nobody not deserve a death like this. And we can't believe we enjoy ourselves so last night for her birthday and get called say she lose her life, leave her 3 kids. She had a breadwinner for her family, and there is no more Stacy. We call her Slimmers. Slash, yeah, that's what here. Her throat was slashed. And I beat her in the house, and I said, then I beat her in the house and I bought for murder, and there was no one there to help her and catch the house afire with her and leave. That's what I heard. I'm not really sure. So she burned out to nothing. Nobody is not there to bury her, anything like that. Burn right out. She didn't have naturally live at Chancelling, but this Eam house, the incident take place on Beeston Street. I think the address is 37 Beeston Street, I'm not sure, but she live at Chancelling, 6 Chancelling with her kids. Her 3 kids and her mother. We came in after 8 last night. Our friend them drop around about the time when them drop around, probably it would have been like to 9 when them drop around, because when we leave it was after 8. Them drop around, they wait on the car for drop around. So it roughly about to 9 when she reach at his place, and then my friend them go home, them get drop home at for them house. So when I get the call this man, it was after 4, but them said the fire set after 2.
Sandy Shaw Dawson, district officer from the York Park Fire Station, confirmed that charred remains were recovered from the burnt building.
We have received this call of building on fire at 3:46 a.m. 2 units from the York Park Fire Station, one from Rollington Town, and one from Trenchtown substation responded to this call. At the moment, we do not know what's the cause of the fire, but it's presumed that a female body was lost in the fire. We found remnants of the body also. At the moment, there is 31 persons homeless. It's a tenement building. It's actually two tenement buildings. You have one at 37 and the other at 37 and a half Beeston Street.
And those are some of the stories making news. We will return with more stories related to International Women's Day activities. But first, let's take a break and then join Christopher Scott with sports.